Good morning, everyone. My name is Novita Sari Indrawati, and I'm currently a fifth semester student. Today, we will discuss about occupational health and safety procedure before drug compounding. Before we go deeper into the topic, I want you to imagine something. So what? Imagine that you are working in a pharmacy laboratory and you are about to compound a drug for a patient. What do you think will happen if you ignore safety procedure? A small mistakes in drug compounding can cause serious health risks, not only for the patient but also for the health worker. That is why this topic is very important to learn. Today, I will explain about occupational safety and health. Simply put, occupational safety and health is about keeping workers safe and healthy while they are working. Why is this important? Because every workplace has risks. If safety and health are not applied properly, accident and work-related disease can happen. So, by applying occupational safety and health, we can reduce risk, prevent accident, and create a safer working environment for everyone. In this lesson, there are three main objectives. First, you will understand the concept of occupational safety and health. Second, you will be able to identify potential hazard before drug compounding. And third, you will understand how to apply safety procedure correctly. These objectives are important because safety should always come before productivity. Now, why is occupational safety and health very important in drug compounding? First, it protects the health worker from chemical exposure. Second, it helps maintain the quality of the drug. And third, it ensures the patient safety. If safety procedures are not applied properly, the drug may become contaminated and harmful to the patient. Okay, before we starting drug compounding, we must identify the potential hazard. Here are several potential hazards that may occur during drug compounding. The first is chemical hazard. This hazard can come from exposure to drug powder that may be inhaled during the compounding process, which can cause irritation to the respiratory tract and the eyes. And the next hazard is biological hazard. This can occur when we handle compounding tools or surrounding objects that are dirty and have not been properly cleaned. The last is physical hazard, which may be caused by broken or damaged compounding equipment that can potentially injure our hands. And the next one is safety preparation. The safety preparation is a key part of occupational safety and health. Without proper preparation, the risk of accident will increase. So, that is why all the safety procedure must be complete before the compounding process begins. What should be prepared before drug compounding? The first thing we need to prepare is personal protective equipment or PPE, such as an N95 mask, lab coat, hair cover, and medical gloves. The next is hand hygiene. Even though we use glove, we still need to wash our hands with antiseptic or soap before drug compounding. Why is this important? Because wearing gloves does not guarantee that our hands are completely free from germs and bacteria. The next thing to prepare is a proper workplace. We must ensure that the working area is clean, sterile, and well organized before compounding a drug. Lastly, we must follow the applicable standard operating procedure and check the drug labels and expiration dates of each medication to ensure safety and prevent errors during the compounding process. So, guys, ignoring occupational safety and health during drug compounding can have many negative effects. First, health worker may be exposed to drug powder or chemical substance during the compounding process. The substance can be inhaled or come into contact with the skin and eyes, which may cause breathing problems, coughing, skin irritation, or eye irritation. If this exposure happens repeatedly, it can lead to more serious health problems over time. And second, poor safety practice can cause biological contamination. When health workers do not wash their hands properly or use dirty tools and equipment, germs and bacteria can easily contaminate the drug. Contaminated drugs are dangerous for patients and can cause infection or unwanted side effects. This condition can reduce the quality and effectiveness of the medication. In addition, ignoring safety procedures can lead to physical injuries. For example, broken glassware or damaged compounding tools can cause cuts or wounds on the hands. These injuries not only harm the health worker but can also interrupt the compounding process and delay patient treatment. Unsafe working conditions can increase stress and reduce focus during work. When safety is not a priority, mistakes are more likely to happen, such as incorrect measurement or wrong drug selection. Applying optional health and safety procedure is very important to protect health workers, maintain drug quality, and ensure patient safety. Based on everything that I have explained earlier and the example that you have seen in the video, it is clear that safety procedure before drug compounding play a very important role in daily practice. Drug compounding is not only about mixing medication, but also about managing risks that may affect health worker and patient. Each step, starting from the use of personal protective equipment, hand hygiene, workplace preparation, and compliance with standard operating procedure, has its own function in controlling potential hazard. When these procedures are not followed properly, the risk of chemical exposure, contamination, and physical injury increase. For example, skipping hand equipment may seem like a small issue, but it can lead to serious health problems or medication error. On the other hand, proper preparation helps create a safe and controlled working environment. Safety procedures should not be seen as an additional burden, but as an essential part of the drug compounding process. By consistently applying occupational safety and health procedures, we can minimize work accidents, maintain drug quality, and ensure patient safety. So, in conclusion, occupational safety and health procedure before drug compounding are essential. These procedures help prevent an accident, protect health workers, and ensure drug quality. By applying occupational safety and health correctly, we can create a safer working environment. Okay, thank you for your attention. If you have any question, we can discuss them in the next session. Goodbye.